What sets your company apart, and what do you do differently that gives you confidence in winning?
I'm Monique Nadeau. I'm the co-founder and CEO of EatLove. I'm a recovering investment banker, formerly worked on the Affordable Care Act, and I'm trying to get into heaven. So super excited to be here with all of you. So EatLove's AI-powered nutrition intelligence technology is uniquely positioned to make food as medicine scalable, affordable, and personalized for everyone. We do that in three ways. Firstly, we connect clinical recommendations to everyday choices. So our adaptive operating system guides the 200 decisions we make around food and diet every day. We do that based on 5 million dietary factors, whether you're cooking at home or dining out. We looked at every meal choice within the context of your overall nutrition needs and lifestyle. Secondly, we scale clinician impact. Over 8,000 physicians, dietitians, and other qualified clinicians use EatLove to deliver clinically validated nutrition prescriptions based on up to 100 macro and micronutrients, supporting 97% of all health conditions. So whether it's from PCOS to diabetes to recently launched GLP-1 Nutrition Companion. Our Pro platform automates routine tasks, allowing dietitians with our value-based contracts to support 5 times more patients and enable other clinicians to be able to provide evidence-based care within their scope of practice. With only one dietitian, this is what I learned with working on the Affordable Care Act, with only one dietitian per 5,000 Americans, we need to find ways, innovative ways to be able to expand our current workforce. And then lastly, EatLove partners with major grocers, ready-made meal providers, and has access to about 10,000 restaurant meal options to deliver precision nutrition. We recommend currently over 1 million meals a month, and we leverage massive supply chains to dynamically create medically tailored meals for an average of less than $4 per serving.
Tell me about your proprietary moat a little more, your medicine. What's so different and unique about what you guys are doing at EatLove?
Sure. So what makes us unique is the fact that we actually go down to the macro and micronutrient level. And that's really important because we talk a lot about what is a nutrition prescription in a very general term. But when you think about the DASH diet or the MIND diet or what's appropriate for someone with comorbidities, what we find is that being able to have the right food in the right amount over time is really important for driving outcomes. And so the fact that we can go down to that atomic level, and we actually spent 3 years in R&D to be able to do that, means that large health systems, employers, clinics will use EatLove to be able to actually prescribe food and to be able to do that for 97% of all health conditions. So if you are, to give you an example, if you are an individual with PCOS, with with PCOS, with insulin resistance, you have a child who's allergic to tree nuts, you like to eat oatmeal for breakfast, you're on a budget and you only have 15 minutes, EatLove's going to be the platform for you. And knowing that we find that the diets that folks and the food that people choose are the ones they can actually follow. So if I could, I want to tie into the question that you asked about why can't you just buy it at Albertsons? With EatLove, you actually can. And I just want to make that distinction. The fact that we have and we're built upon almost 1 million foods, we create medically tailored meals dynamically and create combos in a way that actually ladders up to a nutrition envelope for each one of those health conditions.
Give me a case study. Give me something basically a family or an occurrence, something you guys are super proud of that you can share.
So I was just thinking about Tara, who had reached out to us. She had a pretty poor relationship with food growing up. She didn't know how to cook. She didn't want to cook. She was eating at fast food. And so for most of her meals, and she reached out to me. She found my information on LinkedIn, and she said, listen, first and foremost, I learned how to use EatLove where I just used 1 meal a week. That was it. It was 1 meal a week. Imagine Spotify for food. EatLove produces a meal list, and you can do 1 meal or you could do 25 meals. And she said, I just want to do 1 meal. And then she added, she goes, I just want to batch that. than it was. And being able to feel, to be able to add her own health conditions and generate what are some of those options, she then was able to say, okay, I can actually go to Starbucks. And the fact that we could map her nutrition prescription of what she was eating at the nutrient level, again, not a general scoring level, she was able to eat according to that. And she had lost 87 pounds over a year.
Okay.
And when I asked her, I said, what's the benefit? She said, now I can actually feel comfortable in a wedding dress and I really want to get married. And she's like, I'm really excited. And I didn't even realize that my partner had also lost 50 pounds through this
Great.
process.